Hi, Dr. Stacey Avakian here. We're at Back Pain Relief Center in Vineland, in New Jersey. We're here with Daniela, our front desk person. She does our insurance and answers all your questions. So some of you have followed our videos, have seen that we've done stuff with her before. Today she's having neck and a little bit of upper back, but more over the tops of her arms. She says that she's done trying to get back into exercising and working out, so I think she's probably just a little sore. You're not having any numbness or tingling, anything like that, right? Mm-hmm. Yeah, so we'll just stick with basic adjustment for Daniela today. And then, so the massager just helps things feel good, get the blood circulating. Send that signal to the muscles to relax a little. And it feels really good. And this is an instrument we use. I tend to use it most of the time on everybody. Once in a while I don't. And it helps to break up adhesions or scar tissue or tight fibers between the joints deep in the spine. Some people prefer to get adjusted this way. There are different ways that I can use the instrument. Some people don't like the cracking. Daniela does. And she usually gets pretty good relief from it. So I'll have you take a nice deep breath in and blow all the way out when you're ready. Yeah, you are tighter up there than normal. Good. Okay. Next. Oh, okay. Good. And then I'll have you put this side up first. So lay on your right side so you face me. Straighten this body right out a little. There you go. And switch sides. On your back. All right? Yeah. That was a big one. So good. All right. Come on up. So that's it. Dr. Stacey Avakian, Back Pain Relief Center with Daniela. Have a good day.